new procedure at Munson Medical Center is enabling doctors to monitor patients with heart failure without even seeing them face to face.
In this month's Your Health Matters, 7 and 4's Melissa Smith sits down with a woman who was the first in northern Michigan to undergo this procedure.
Kate Trainer was the first person in northern Michigan to start using a sensor known as CardioMEMS. It works as a heart failure monitoring system.
It looks like a paper clip, almost like a double paper clip with a little thing in the middle. That measures very, very slight changes in pressure in the pulmonary artery.
Trainer's been a cardiac patient for almost 10 years. She had the sensor implanted in February after she started having some heart problems.
It's a simple procedure similar to getting a cardiac catheterization, where a small tube there's a small cut in your groin, but they implanted in my femoral artery a little monitoring device called CardioMEMS.
Once the device is implanted, the rest is simple. So simple, in fact, Trainer can test her heart conditions through the CardioMEMS readings from the comfort of her home.
I lay on a pillow, I push a button. The total time takes less than 2 minutes usually. So I'm in my bed when I do it, lay down on it. I have a little starter button. I push the starter button, a voice comes on and tells me whether I'm positioned appropriately, and then says, ready to go, and a little music comes up, and it's over with within 18 seconds.
If the daily readings are of any concern, the sensor sends them directly to Trainer's physician.
This is probably going to keep me from having heart failure and coming to the hospital. It's going to perceive very slight changes early on.
These slight changes are exactly what Dr. Recchia with Munson Medical Center is looking for when his patients use CardioMEMS.
The CardioMEMS device really is a breakthrough because it's so small, it's so easily implanted, and it gives such a crisp and excellent signal of the pressure, and really allows us to measure those pressures that are really important to managing patients with heart failure.
Dr. Recchia says he knows the status of his patients from the palm of his hand.
Well, the patient can record their pressure any time of the day or night that they want. If it's within a parameter, a range that's safe for the patient, I don't necessarily won't be alerted to that. If it's outside of the range, I'll be alerted through an email that's sent to my smartphone.
Plus, if a patient's heart pressure range needs attention, CardioMEMS alerts physicians like Dr. Recchia weeks in advance.
1 to 3 weeks before the patient starts to have symptoms of a decompensation, of a change in their condition, the pressures start to go up. So if we see the pressures start to go up, we can intervene at that point, get the pressures back down to normal, and to basically prevent that problem from happening.
I feel that they're paying attention to me personally. If there was a problem on my regular reading in the morning, a serious problem, the telephone would ring in Dr. Recchia's pocket, and he would be calling me and saying, we'd like you to come on over.
In Traverse City, Melissa Smith, 7 and 4 News.
Dr. Recchia says the number of times a patient uses their CardioMEMS device depends on the severity of their heart condition.